introduce a little bit about myself. I'm Tanya Kelen from Kelencontent, and we specialize in building brands and specifically rolling out new VR and digital as well as traditional broadcast opportunities. And today we're here to talk about innovations in mental health with one of our new projects with PROMENA VR, and Stéphane is one of our experts and collaborators, being patched in from the UK.
Hello everyone, I'm honestly sorry not to be there with you because I'm currently in the UK attending a conference, and actually my talk will easily follow on the previous talk that just finished, because I want to bring in 6 minutes information about scientific evidences that using VR actually leads to real improvements. And to start, I need to insist on the fact that there's been tons of clinical trials done since at least the year 2000. You can see the book Advances in Virtual Reality Anxiety Disorders that we published with Brenda Wiederhold 2 years ago. And to start with, the largest and probably most significant, in terms of history, most significant randomized controlled trial has been done by Barbara Rothbaum on fear of flying. That was done in the US. And you can see on this slide that if we randomize patients that are suffering from an anxiety disorder, specifically fear of flying, and I need to insist or make it clear that when we treat people suffering from fear of flying or any anxiety disorder, the key ingredient, the thing that matters, is actually facing your fear, what we call exposure. And the advantage of virtual reality is we can adjust the pace of exposure. So we can actually manage exposure, so we can really tailor the treatment to each specific patient's needs. And what they did in that study is they compared the waiting list, the virtual reality with all the exposure done in virtual reality, or all the exposure done in vivo, standard exposure, when you actually go to the airport. And they showed that, obviously no change on the waiting list, but from pre to post, there's a significant improvement in those receiving virtual reality-based exposure, and the treatment is as effective as face-to-face, traditional in vivo ones, and the gains are maintained at follow-up. That study showed that they actually gave or offered patients flight ticket, and the patient actually flew 85 to 87% of the patients actually took the plane ticket and actually flew, which is kind of a concrete observation that we can actually change people's problems with virtual reality. And this is another study we've done here in Gatineau, where we compare for fear of spiders, and we have a real-life spider, a real-life tarantula, and a virtual spider. And again, the same results. You see that pre to post to follow-up, patients are improving as much as they would do when they do in vivo, when they actually have to deal with a live spider. So virtual reality works, it does work, and you can measure change by asking patients to actually open, as you can see on this slide, opening a vivarium where there's a live tarantula, and they could play with the tarantula with a pen, and they could actually succeed doing that. So it's an objective measure of treatment success. Many people are suffering from phobias, but they're not going for treatment. But if you look at social anxiety disorder, that's a paper we just published in the British Journal of Psychiatry a few months ago, where we compared waiting list and standard therapy, where there's in vivo exposure and virtual reality one. And you can see if, for example, you're talking at the corner store, you're in the restaurant, or there's virtual classroom, you can actually face what you're afraid of doing those exposure exercises in virtual reality. And the results are quite stunning because, well, the horizontal red line is the cutoff score for clinical and non-clinical scores. Well, the black line is waiting list, it didn't improve. The blue line is those receiving the standard treatment. What is most interesting is those who received the virtual reality treatment, they improved essentially as much, and in some cases more, essentially as much as those receiving the standard treatment. We use 6 scales in that study, and 2 scales out of 2 scouts out of 6, essentially this one, showed that actually virtual reality was more effective. So we can even do more in virtual reality than we could do in vivo. And what is fascinating is the other graphs that you can see there is the cost and efforts associated with virtual reality. And you see that the long bar, is the cost associated with doing therapy with in vivo exposure. And the B, the smaller bar, is the cost of doing the exposure in real life situation. B is in a virtual reality situation. So A is a real life situation and B is a virtual reality situation. And there's a huge difference in terms of cost. The cost is essentially providing the virtual reality environment, but the rest is no cost at all. So if you compare, not only virtual reality is as effective or more on some measures, but it's clearly more efficient. So there's advantages for both patients and therapists of using virtual reality because you can tailor the treatment each patient's needs. Well, social anxiety is one issue. Let's take another one, obsessive compulsive disorder. That's another study we just published this year on obsessive compulsive disorder. Let's focus on one of the graph, the one on heart rate. And you see that the line, the first line, is not changing from the neutral environments to the contaminated environment. The contaminated environment is a progressively disgusting bathroom. People suffering from OCD, we have to bring them to actually touch different environments that are progressively disgusting because they have a fear of contamination. And what you can see is no change in the normal controls. So this is really important because it has been shown on and on and on that people who don't have a specific emotional relationship with some stimuli, in that case, people not suffering from OCD, are not reacting specifically stronger. But if you look at those suffering from OCD, you see a clear, significant, much larger impact, the dotted line, meaning that people suffering from OCD are getting these virtual germs in these virtual environments. And that led over the years to actually the publications of empirically validated treat manuals. We know what to do, we have a recipe, and it's been published in English, in French, even in Spanish. And it's for anxiety disorders, for gambling addictions. So as a community using virtual reality for mental health, we're now at the fact that we have these scientific results to the fact that we actually published those papers and got the treatment manuals out. And we moved from one part of this slide, which is the whole lab, to actually a clinic where we can actually distribute the virtual environments. So one of the things to remember the 2 take-home messages from this talk is there's actually a lot of data existing for anxiety disorders. So the second take-home message is let's not reinvent the wheel. Please take use or better use of what's already available to make treatment more affordable, more accessible to patients, but let's not reinvent the wheels because there's tons of data so far, at least for anxiety disorders, and it's a flourishing field for other mental health applications. Thank you very much.
Thank you so much, Dr. Bouchard. Thank you for getting up so early in the UK and for giving us all of that wonderful information that so many of us working in VR, thank you for your expertise and research is invaluable, and you're one of the giants, and that's our conference topic here, building on the shoulders of giants. And we're so excited to be presenting so many other people here today, especially everyone here who's really advancing VR. And with that, I hope you can watch this. I don't know if he can be patched in to see what we're doing, but we'll send you a tape. We have it recorded, so you'll be able to see it. Thank you again. And now I'd like to introduce Dr. Lora Appel. She is project lead at UHN OpenLab. She's a research scientist, a Ph.D., and she's doing her postdoctoral fellow at York University in the Faculty of Health. Lora currently leads Prescribing VR, VRX, a collection of studies that evaluate AR, VR, and MR in clinical settings. And thank you so much for being here, and you can open up her presentation.
Okay, so welcome everyone. As Tanya mentioned, my name is Lora and I work out of an innovation center based out of Toronto General Hospital, but we're basically in the conglomerate of the largest research hospitals in Canada. That's Toronto General, Toronto Western, Princess Margaret Hospital, which deals with cancer, and Toronto Rehab, which is world-renowned for simulation in rehab. A lot of our work deals with user-centered design, so we have innovative ways of kind of transforming how healthcare is delivered and experienced. And I think the best way to go about this is I'm just going to briefly touch on the different projects that we evaluate virtual reality in clinic care. And I think the difference with some of these projects is really that they're inpatient care. So we're talking about acute care in hospitals or inpatient care with cognitively impaired. So it's not people seeking aid at outpatient clinics, which is quite unique. Yeah, and I'll tell you about it in a sec. So the largest project, VRNR, which is Recall and Relax. So this is a project where we're exposing dementia patients and the cognitively impaired, so that's anyone on the spectrum, there's no exclusion criteria, to simulated natural environments. So we know that being outside in nature delivers a lot of benefits even for the average healthy individual. We're seeing if those people that are cognitively impaired and are increasingly confined indoors because they can be a harm to themselves if they wander, or they don't have the social supports to go outside. They're physically unable. In Canadian winters, this is increasingly difficult. And as was mentioned in previous talks, the aging population and the baby boomer population, this is only going to increase, and we're not going to have a way to properly deal with this population. Currently, the alternative medications are basically, a person wakes up, they go and eat, and they're sedated into sleep. And that's a lot of times how our grandparents are living out their last years. So we have a partnership. We've been funded by CC Abbey out of Baycrest to run a pilot trial in 4 different sites: Kensington Long-Term Care, Runnymede Rehab, Baycrest, and the Dots of Bitoff Academy for Wellness. And we're looking at how this impacts depression, anxiety, medication, sedative use, the propensity to wander. So we're in early stages, but Michael Garron Hospital is very interested in running a randomized control trial in the future and really looking at not only looking at more objective and biometric feedback. And it turns out that among these things, we found that exposure to virtual reality environments helps to trigger memory, which is incredibly important, obviously, for people with dementia and Alzheimer's. So a side study has emerged where we are working with the cognitively impaired that are still able to describe more of their trigger memories, and we want to kind of customize and reproduce some of these memories early on and then expose patients to it later with the hope that it will help revive people. And I'm not sure if anyone's seen that documentary Alive Inside, where a social worker in the States exposes dementia patients to music of the youth of the patient's era, and it turns out that people who were once completely non-responsive and antisocial come back to life and recall memories. There's 1 minute? Okay. We're working with Princess Margaret Hospital to reduce anxiety in radiation oncology patients. Here you see an x-ray of patients that, compared to a regular, their heart next to the wall of their chest, if they breathe deeply, they can distance their heart from the wall of the chest, and this will reduce radiation to unwanted parts of the body when getting treatment. Also, they're quite unaware radiation treatment is something that radiation you're told to avoid most of your life. It's not visible. At the beginning, you don't feel it, so patients are quite confused about the treatment and don't tend to take it, even though it mitigates a lot of the risks that surgery might bring. So we're trying to educate patients with augmented reality situations where they walk into the clinic room, see their own bodies. We explain how rays might target certain organs. We're working with York University, and we have so there's a big problem with interprofessional communication. Specifically, the medical and nursing staff don't understand each other, don't know each other's roles. There's a lot of cultural barriers and insults that go around that actually have an impact on patient care. So we're looking at building empathy by doing this scrub exchange where a medical student and a nursing student can put on VR and kind of experience both the skills and how people are treated in the workplace. We have other projects like trying to induce testosterone in patients because we know that testosterone reduces depression and anxiety, and we're hoping that this will help patients recover. There's a lot of more studies, but I don't have time to talk about them. Another minute. I'll talk about the future important aspects of AR, VR, and MR in healthcare. So I think there's this concept that I need to focus on: less is more. So a lot of times in the industry, we want greater fidelity, more immersiveness, and this is not what my dementia patients need. They need, things that will reduce motion sickness, which is a lot less light, less sound sometimes. There's a big need for improvement in hardware, and I know that things have really improved in the last 2 years, but These head-mounted displays, they really don't suit people with glasses. They don't suit people with hearing aids. A lot of patients have wigs. You take off that headset, so it goes their wig, and that's a problem for stigma. I was actually, for example, we use the Samsung Gear VR for a lot of our patients, and I was disappointed that the controller is right where everyone would initially hold the headset. It seems very counterintuitive. And then Samsung VR came out with a new one with a controller, yet they kept on the headset the touchpad, so it's a problem. There's issues with the economic argument. If some aspects of the hospital invest in the VR, the patients will receive the benefit in a different department of the hospital. And so especially for the Canadian system, this is an issue. And there needs to be a lot more investment. I guess my plug would be that the pharmaceutical industry has invested a lot in building drugs to attack different conditions. And if the VR industry would invest in this kind of research in healthcare, I'm sure we would find many more applications. So I just encourage people to donate money to my cause. And
Woohoo!
Yeah.
Go,
Okay,
Lora.
thank you.
Thank you so much for that incredible presentation. And you're doing the most meaningful work in your field. And we're so grateful to have you here.
It's great to see the results. I have to say, it's great to see in person that this actually makes the difference. So,
Thank you so much. Let's give Lora a round of applause. And now I'd like to introduce Thomas Overley, who's the co-founder of PROMENA VR, and he has been one of the few VR therapists practicing since January 2015 with his own VR therapy clinic. Since September 2016, he's developed the PROMENA VR system, and he is co-founder of PROMENA VR as well as VR Therapy, and the company is based in Michigan, and now he's also the co-founder of PROMENA VR that's launched in Toronto, Canada, which we announced here at VRTO.
Okay, so Tanya just gave my entire introduction for me, so we'll skip ahead. Did we have the video
We have the
prepared?
video that is ready to run at, yeah,
Yeah, please.
the demo. Yeah.
Okay, so that video just gave you, in a nutshell, some of the things we have worked on and some of the things we're moving forward with right now with PROMENA VR. When I started seeing clients in January of 2015 at VR Therapy and Counseling Center, I was focused mainly on treating anxiety spectrum disorders because, as Dr. Bouchard spoke of earlier, that's where the evidence was. And there was enough out there at the time that I knew when I opened the clinic that it was safe for me to go into this area and start using these tools in the treatment of these anxiety spectrum disorders. So I worked with many cases of PTSD, specific phobias, social anxiety, And the way we approached that at the time, it wasn't a very cost-effective way to approach therapy. And when I started out, people would come in, I would do the initial psychological evaluation, learn about their problems, and then as we started moving forward and I continued to learn about them, I would go back and I would build each program that I was using with them specifically for them. We didn't turn to, some of the stuff on here, they used stock footage just to give you an idea of the range of things that I've dealt with, but really it doesn't represent the many individuals I've worked with over the last
Tell us about
couple of
those
years.
individuals, and we have about 1 minute to wrap
Oh.
everything up because we ran late with
Oh.
Stéphane Bouchard.
Okay, well, why don't I transition to the point of PROMENA VR, though?
Yes.
Because during that time, 25% of my clients were those suffering from anxiety spectrum disorders. The other 75%, and including that 25%, one issue I saw that where I saw the potential that could be found in VR treatment protocols is in the interpersonal realm with things like communication. But I knew I couldn't just turn to AI to do that. I couldn't put clients in there and have scripts for their interactions. So the light bulb went off above my head and I figured out, okay, I need to be able to get into VR with my clients, and that's what PROMENA has been focused on. We've designed software that using advanced facial and body tracking, now we can convey all of that information and map it to characters within VR, so I essentially become whomever I need to be for my clients. So
In an avatar situation.
right. So the wonderful thing about that is the old style way of approaching interpersonal and communication issues, I would have to do role plays there in session where they would be staring at me, a middle-aged Caucasian male, and we'd have to rehearse these scenarios that were going on in their lives, and then I would have to give them behavioral homework so that between sessions, I would ask them, okay, here are some scripts that I want you to work on. Next time you run into these situations, here's what I want you to attempt to do out there.
What's your biggest takeaway right now that you want to say in 20 seconds?
20 seconds is PROMENA VR wants to bridge that gap, get our systems out there into other clinicians' hands so that they can do all of that original work that I've been doing that has been tremendously effective in the anxiety spectrum realm, but also move us all into the behavioral realm so that we can go in there and keep customizing VR experiences to meet the needs of every individual we're working with.
Thank you so much for everybody being here today and for the fabulous panel and VRTO and Karem and everyone who put this on. Thank you.